are the criteria for using a traction splint?
You try to sneak in, dude?
Returning students sure should know.
I don't know.
What is it, Steph?
Criteria?
For using a traction splint? What is the reason we would use a traction splint?
The reason we use a traction strip for a femur fracture or break, or if you broke your femur, is to pull traction so it doesn't include an artery, a femoral artery, so you pull traction on it. Right?
Sort of. Anybody else? You said it was for a femur fracture. What area of the femur are we going to pull traction on?
The mid shaft.
The mid shaft, right? Okay.
So what if it's lower down here? Can we use it? No. What if it's up in the hip?
No.
Okay.
And what if any other part of that leg or hip is broken? Can we use the splint?
No. How about if their tip fit's broken?
No.
Okay, so the criteria is closed mid-shaft femur fracture with no other involvement of pelvis and lower leg, right?
I thought it could be open.
It can be open.
If you're using the hair, not the sager, because this strap goes over
The break.
break versus the hair has 4 straps. This only has 3.
And the reason you may know it's open is it broke, went through the skin, and then went back in, so you would see what there? A puncture, some bleeding, and that kind of thing, so you're going to treat that area with bandages. And if the bones are exposed, you would use a dressing, cover the bones, but when you pull traction, it may pull those bones back into the skin. So
you're saying it is okay if they
it's
have the
okay
holes.
because the manufacturer has that in their instructions, and also on the national scope, I guess we've decided that it is okay.
So if the bones did penetrate the skin and went back in, you can use it, right?
You can use
If you're using the hair, but you can't use the sager.
Even if the bones went back in after they snapped?
yes.
Any open one.
Okay, so everybody good on that?
Yes, ma'am.
Mid-shaft, femur fracture. Isolated injury though, pretty much, right? Because if he has 2 femur fractures, it's going to be a rapid transport.
Yeah.
Everybody got that? Okay.
Okay. So before your sager, what does the first step say?
PSI, PPE.
Good job. All right. So you all should have gloves, goggles, everything else on, right? Okay. All right. What's the next step say? Okay. So what does it mean by expose the injury site?
Got exposed.
All right.
Putting this on
Cut their
YouTube.
pants all the way up to their groin. Don't.
I'll put on.
Sorry, gotta cut your pants. As Mr. Schultz says, you have injuries that I can't see and you can't feel, and I'm sorry these are your favorite pair of jeans, but we're gonna cut them. All right. So what does it say next?
Check circulation.
How are you gonna check circulation? Where are you gonna check?
They're
Well, yeah. Okay. So they say I broke my right mid-shaft femur. Where are you gonna check on me?
your right.
What are they called?
Just my right foot?
Both
Right
feet.
and
Both feet.
Bilateral.
So your PMSC.
CMSC.
So what does P stand for?
Pulse.
Motor
What's-
tone.
Motor.
Sensation.
Sensation, circulation.
Okay. So a good thing is, can I borrow you? Okay. Just have a seat. All right. So we're gonna say that she broke her left femur mid-shaft. We went ahead. Obviously, we've got our gloves and everything on. We're gonna go ahead and cut and expose. I see that she's got, some deformity. She has some pain, but no bones are sticking out or anything like that. So what I want to do is I'm gonna have a partner. All right. So we're going to my partner here, Victor. If you want to come on this side, because you're fractured on this side. We're gonna go ahead and I'm actually gonna take her boots off. So he's going to stabilize her legs while I remove her boots so that we don't cause any extra trauma to her leg. So obviously with you guys in your boots and trying to get them off without manipulating is going to be quite difficult. So you're going to make sure you move. Hope you showered today.
Even if it's like, say, a motorcycle accident, you still have to take their big motorcycle boots off?
Oh heck yeah. Absolutely. If you got CHP officer and their boots cost $500, sorry dude, we got to cut your boot off. They'll probably cry and yell at you, but you got to cut them off. So
And he's just keeping this one.
he's keeping this one stable. So making sure he's not touching the fracture site, but he's making sure that that stays stable.
Now, I don't want to be picky, but
Yes.
can you assess her body to show that there's no other breaks?
Yes. Of course. I was trying to get. Oh, I
So undercut and expose, it's cut and expose and determine your midshaft, and it's also to check the rest of the body so you're not going to be pulling traction on a
another
broken knee, a tib-fib fracture, or an ankle fracture too.
Alright, so we've assessed that this is her only fracture here. Like Miss Duncan said, there's nothing down here, there's nothing wrong with the feet. You're going to go ahead and check pulses on both sides. When you find a pulse, take a pen, mark an X so that you know where they are so that you don't have to look. Check cap refills. She's got polish on, but you can still check the skin. She's got good cap refills. She can wiggle her toes for me. Go ahead and wiggle your toes. Good. She can, you know, you can say, okay, what toe am I touching? Yeah. So do that on both sides. Which toe am I touching? Pinky toe. Yeah. Try not to do it right in front of them so they can see it, because then that's kind of a cheater way. So we've gone and exposed. What's the next step, say?
Measure traction device against injured leg.
Okay. So
No, that's the hair.
Yes, ma'am, sorry.
For
what's it
exposing the
in?
injury site, it says assess pelvis for possible injury, assess
Okay.
femur,
Mhm.
assess lower leg, assess ankle.
So we've checked. So with the pelvis, you can check and palpate. Make sure you palpate on both sides. You can push down. If she says she has any pain, we're not using this. So if she says no pain, it's all good. We assess the rest of the way. Yeah, she's got some pain, deformity, possibly some bruising, swelling already going on, but no actual open fracture. Check her knee. Make sure that's stable. Go ahead and onset, offset pressure at the tib fib. Again, check her feet. We've checked her PMSCs. Now what do we do?
Position traction device on injured leg, inner aspect of injured leg.
Okay. So for this, see how this is curved? That's going to go on the inside of the thigh. And for gentlemen, when you're, or for any of you who are putting this on a gentleman, ask them to move their man parts aside so that you don't squish or anything of that sort, pinch. That's not going to feel very good. You can also use some padding on this as well. You can take like abdominal dressing, trauma dressing, whatever, put that so that it's not, you know, up in their business. Alright, so we're going to have, this one keeps falling apart. Alright, so you're going to have to feed this strap an easy way. You've got your straps going on. This is going to go up in their pelvic area, and then you're going to go ahead and secure it. So I'm going to go ahead and feed it under the knee because that's where you have a gap. And then I can shimmy it up to where it needs to go. So we're going to get a little personal with you here. Alright. So then does it say to so we also are going to measure it out, make sure that this goes in the foot. And
Secure groin strap.
secure the groin strap. So you're just, it's kind of like a little D-ring like when you C-spine. You're just going to go ahead and feed that through. Make sure it's nice and tight. And if you want to open your leg just a little bit, sorry, that sounds kind of awkward, but alright. And make sure this sits up nice and high. And then we're going to go ahead and secure it because we're using this to pull on her leg to create traction. If you can turn that for me, that'd be great. Okay? So he's going to go ahead and tighten that. And try to get the strap up as high as you can on the hip. Again, with females, it's not too bad. You're going to try to get it right in their groin area, but guys, just watch.
Alright.
Alright, so try to get it a little tighter.
Keep sliding down because I think it's these kinds of pants are really.
That are slippery.
Yeah. There we go.
Alright, what's it say for the next step? We've secured the groin.
Secure ankle strap or hitch.
Alright, so we have an ankle strap. Okay, so this is your ankle strap. This is what it looks like. This goes under the ankle. You just slide this underneath, use this thinnest part to go underneath. This one's already attached. And then you'll secure it around the ankle. So, and some of these come with extra padding if you've got bigger people with bigger ankles or versus people with skinnier ankles. You just pop that off. She's got pretty small ankles, so I probably won't need all of this padding. So obviously these won't be there. You're just going to go ahead and slide it under. If your Velcro doesn't completely stick. Without moving the leg.
So where does the ankle strap go?
On the ankle.
It's not a foot strap, right? It's not a heel strap, right? You would be surprised.
Exactly. Alright. go ahead and secure that so it's snug. And then we're good. Okay, so the ankle strap's on. Now what does it say? Okay, so what he's going to do is make sure the leg stays stabilized, and I'm going to go ahead, if he can hold the ankle, and I'm going to go ahead and pull traction. So this is a roller device. There's a little roller clamp on here that tells you how much traction you're pulling. So we go, does it give you how much you're going to pull? 10% of their body weight up to 15 pounds. So, sorry, how much do you weigh? 120. So how much am I going to pull on her? 12 pounds. Good. Okay. So, watch your feet.
So if she weighs 180, how much?
300?
No.
Up to 30. Doesn't go that high. So if you want to hold her ankle.
15 max.
So all you have to do is just pull this. So there's numbers on here so I can see how much I'm pulling. So I'll go up. There's 12 pounds right there. It may go back a little bit, but once you pull it, you don't want to try to pull it again because you're probably going to slip and it's going to go back. So how does that feel?
It feels like it's pulling.
It feels like it's pulling. All right.
You're supposed to go.
So the whole point of the traction is that if your bones are not where they're supposed to be, the bone ends and stuff are probably in your muscles, causing extra trauma, bleeding, swelling, bruising, all that stuff, immense amount of pain. So what the whole point of traction is to pull them in line so that the bone ends lined up so there's less trauma and there's less pain to that extremity. How much blood do you think you lose with a femur fracture?
15.
Good. All right, so is that a lot of blood or a little blood? A lot of blood. Good. Okay, so you want to try to reduce that bleeding along with the pain. So we pulled that. So what happens after we pull traction? What do we do?
Secure the legs, support the straps.
Okay, so we should reassess and make sure we do have good, that we do have PMSC, distal function, anything like that. Ask them, how's your pain now? Does it feel any better? Hopefully, like Ms. Duncan said, they go, oh, it feels so much better. So yeah, we're going to secure the straps. So we've got 3 straps on the Sager. So the largest one, you'll put, move this leg over here. I think that little one. Yeah.
Okay, you guys, all of the equipment has been used for the last 9 years. It's probably the same traction splints I've had from 98 here. So be aware that they're well used, okay?
So you're going to put your strap, one's across the mid-shaft femur right over the break. The other one's going to go over the knee, and the other one's going to go down a little further over their shin. So what you want to do is you want to put the top one on first because you're going to go underneath the knee because that's where you have the biggest gap underneath. So you're going to pull it under without having them move, and then you're going to shimmy it up underneath, and then you can secure it from there. And then you'll put your smallest one on, again, because, the stupid Velcro and carpet do not get along. Shimmy it down.
I don't think I've ever put a traction splint on carpet.
Yeah,
On a
I don't
person
think
on-
I have either.
In fact, I've not hardly ever done it. In 25 years in the field, I've placed it twice. Have you ever done it, Ms. Finn?
I've done a Sager
Once in your career?
Yeah.
It's not a very common machine to use because they break everything. When they break a femur, they have other injuries most of the time. So it's not often used for an isolated.
Yeah. So we got all our straps on up at the mid femur, over the knee. So make sure you feel. Obviously, you'd have it cut and exposed so you could see, and then over the leg. All right. Then go ahead and reassess your PMSCs again, and then you're gonna go ahead. Are we having them put them on a backboard or?
No, but the free point would be to put the legs together and elevate. It's a number 9. But with men, I've found that if you put their legs together with this device between their legs, they don't like it.
No.
And even women too, because
It
it's
gets on.
just really intrusion in that groin area. So you might skip that or just elevate the one leg.
We're not elevating anymore though.
We're not. So we need to fix this skill sheet.
Yeah, we're not elevating anymore.
But I highly recommend not tying the legs together either.
Yeah, no. they'll probably.
So then they would be backboarded and transported after you
Yeah,
did your
per-
PMSC.
For the hair, I know per the manufacturer's regulations, they're supposed to be on a backboard for this. I don't think the Sager you have to,
Okay.
but I know for the hair you do.
So as far as the skill sheets go, that's about it for that one.
Any questions on how to apply anything, when to use it, when not to use
Yes.
it?
On this grading criteria, are we
Sorry.
just scratching 9 off then?